Hello everyone. Today we are here with Dr. Wafaa, President and Chair of MEAPEN. Hello, Dr. Wafaa. How are you?
Hi, everybody. I'm happy to be with you.
So, as the President of Chair of MEAPEN, what inspired the formation of this organization, and how does it aim to elevate clinical nutrition practices in Middle East?
Well, all the speakers are from all over the world, from the biggest societies in the world that they add value to the by the guidelines, by the principles they are doing, by the policies. So they are here. They came from USA, from Europe, from all over the region to give us the latest updates about clinical nutrition to educate our community of healthcare professionals.
So, MEAPEN focuses on enhancing nutritional practices for both enteral and parental therapies.
Yes.
How do you see the region progressing in terms of standardized clinical nutrition guidelines, and what role is MEAPEN playing in this journey?
Well, that's the main reason. We are here to do a unification of standards. So when there is a guidelines all over the world, this guidelines can be implemented in Dubai, in Kuwait, in Qatar,
Entire
in
Middle East.
USA, in
Okay,
the-
globally,
yeah.
globally.
So it helps to roll up what is the patient's case, what is the best education, what is the best treatment, up to date.
Right.
That's what we are doing. We are bringing the science here.
So you have a remarkable track record in launching public health initiatives like DHA to Home and Tummy Fish. So how do these projects reflect your philosophy and community-based nutrition education, especially for children and families?
Okay. Now, these are two different ones. DHA at home is a concept of the patient used to come to the hospital, wait for a long time to take their medication, their supplementation. What I did, I made the product to come to their home. The feeding come to home, so they don't have to suffer since they are elderly or handicapped or something. So we save time, we save cost, and we give better. Now, tummy fish, it is about a fish living in the tummy. It's an app. I did it to educate the children about the importance of water and how to take water. So these encourage the children to be hydrated enough, have enough fluids, have enough food, and it talks about everything.
I read that you have also received that Aspen diploma.
Yes.
So
I was the first one in the
Yes,
Arab world.
for Arab world, right?
Yes.
So congratulations.
Thank you.
So how has that international recognition influenced your work locally and regionally in shaping evidence-based nutrition products?
First, getting the diploma, I become a teacher as well in the society.
Right.
And I brought this science to the Middle East and region. Now we are teaching the same concept, the same guidelines to get this diploma in UAE and the Arab world and the region. So they can also obtain the diploma. And since I'm a teacher, up to date to help to implement the science that
Great,
we take
great.
in a standardized form. That's
Right. So as someone directing master degrees in applied nutrition at the University of Sharjah, how do you integrate academic training with real world clinical application for your students?
Well, I am a joint faculty member and advisory board in Sharjah University. I was at the advisory board for the master degree, but now I'm a part of it because, but this helps us to take the science that we are taking into practice and teach our students the top and the best of what they have.
So, MEFN emphasizes research, education, and clinical excellence.
Yes.
What upcoming initiatives or collaborations should we look forward into alliance in 2025 and beyond?
We are hoping that next year it will be a society that unify all the Arabs in Middle East and Gulf and come out with a better standards and a unified policies and procedures.
With your background as a consultant clinical dietitian and your leadership at Al Tadawi General Hospital, how do you balance hospital-based clinical care with strategic leadership at MEAPEN?
Well, actually, from my practice as a clinical dietitian, I find the gaps and I take these gaps and I bring them to teach the people in the clinic. What is missing in the literature, we take it and we educate people.
Great. Given your pioneering contributions in the field, and accolades like the Sheikh Hamdan Award and the Excellence in Healthcare Award, what advice would you give to the emerging clinical nutritionists and healthcare professionals in Middle East?
I will tell them, don't stop learning. Your limit is the sky. So study, learn, help people to reach to the best health that they can do by learning, so you can implement it to the community.
Right. I think that is all. Thank you so much for speaking.
My
speaking
pleasure.
with
Thank
us.
you so much.